Hi, everyone. This is Sean with the Western Mass team of the MassSupport Network, here with your COVID-19 update for Friday, September 11th, 2020. So we'll start off with looking at how cases are doing across the country and across the world. Worldwide, another new about 1.8 million cases in the last week. That's basically how it's been for the last several weeks. Things are kind of at a plateau, maybe a slight uptick this week, but it's hard to say. Things continue to rise in some places and fall in others. The US is fortunately one of those places that's falling. We're still seeing, we're in like the top 3, I believe, new cases per day for countries, with about 250,000 new cases in the last week. However, that is still about 30,000 fewer new cases than we saw in the previous week. So some progress there. In Massachusetts, we saw a little over 1,000 or 2,000 new cases in the last week, which the number is lower than it was early in August, but we have recounted how we're counting probable cases. So probably be another week before I've got a good handle on which way things are really going there. In terms of deaths, worldwide, we've crossed 900,000 deaths, which is about just over 40,000 deaths more than last week. 40,000 new deaths in the last week, which is about 5,000 new deaths in that period. Again, the US is seeing the most deaths in the world, followed by Brazil. The most new cases actually these days are coming from India. We should expect to see just really incredible growth there in the next couple of weeks. They're seeing more than us. And then after us is Brazil, is pretty close to us as well. And those 3 are the top 3 by a country mile and more. In Massachusetts, we saw about 90 deaths in the last week, which is a little bit less than we've been seeing recently. The US saw just about 5,000, which is a little bit lower than it has been previously. However, a lot of these numbers should be taken with a grain of salt for the US numbers because we did just go through a holiday, and that always slows down our reporting and our testing as well. This is the COVID tracking project's data from yesterday. As you can see, just about everything's down there. Cases dropping a lot though, but that is matching with that sharp holiday drop in testing. And we should be on the lookout if there's going to be any spikes coming up from cases contracted during the holiday weekend. But deaths are continuing to decline there as well. So looking at where things are in the country, this is a graph looking at region by million people. So a lot of the drop-off has been driven by the South and West having sharp declines in case counts since their spikes in July. However, the Midwest is still up there. It's dropped a little bit since its peak, but it is the area with the most growth right now. We'll look at that on the next slide here, where we have the new cases per million people over the last week. And as you can see, it's really that central band of the country that's having the most spread there. Now, obviously, a lot of those states are less populous than the ones on the coast. So for example, California, Florida, and Texas, all in lighter colors there, but those are all having several thousand new cases per day. They're just so big, whereas North Dakota is very low population there. Or like, for example, Alaska up there has 117 new cases per million people, but that's like 125 cases per day because it's so sparsely populated. But we'll talk about a little bit more about why some of these places may be spiking relative to population in today's developments. Because some new analysis is showing that the motorcycle rally in Sturgis, South Dakota is a major super spreader source. Now, in fact, there was a large rally there with lots of people going inside, people coming from out of state, a lot of people not wearing masks. That's clearly a recipe for a super spreader event about as clear as the fact that the recipe on a box of Bisquick is for pancakes. However, it's hard to track exactly how much this event is really spreading. There's definitely a spike in the Dakotas from that, but it's hard to follow it outside. One study estimated something like over 260,000 cases were tied to that. Some public officials find that to be a little bit generous, I guess, or whatever way you'd say. It's too much. But certainly there have been several thousand cases directly related to that, either participants or home contacts of participants. And that's why these mass gatherings are so dangerous in COVID times. On the vaccine front, 9 vaccine makers joined together with a pledge to not seek vaccine approval before their vaccines have been thoroughly vetted. This includes AstraZeneca, Pfizer, Moderna, Johnson & Johnson, Sanofi, Glasgow, like basically all the major pharmaceuticals that you can think of in the United States and Europe. And they've also pledged not manufacture any vaccines with safety issues. This is coming following increased pressure for early vaccines in the early fall. But they've all stated that they're not going to try to get approval on any of their vaccines until they know they're safe. They're not going to try to speed anything up past the necessary timeframes for getting good data, and that they're going to not produce anything if it's not safe. And it's funny that that happened earlier because as just this past week, AstraZeneca, one of the leading vaccine candidates, paused their trial recently after a participant had an adverse effect. It was a woman who had symptoms consistent with transverse myelitis, which is a spinal inflammation disorder. And the participant is recovering. They don't know yet if it was related to the vaccine or not, but it has been released that this person was in the vaccine group, not the placebo group, so she did get the actual vaccine. There was a previous pause in the trial when someone else had neurological issues back in, I believe it was July. However, that was deemed to be previously undiagnosed case of multiple sclerosis. That was an underlying thing with the patient and nothing to do with the vaccine, so I went forward. So pausing is a good thing. It means that they are taking safety seriously and reviewing the cases. However, pausing doesn't mean they're actually stopping the trial. It just means they're not enrolling new people in it. There are still several thousand people worldwide enrolled in the trial, and there'll still be data collected on them. And so the science will continue to go forward even if new people aren't starting the trial. And we'll wait to see what the results of this case are. Finally, there was a new study from Harvard on over 3,000 COVID patients, younger people ranged 18 to 34 who were hospitalized for COVID. And it showed that of people in this age range, the younger adults, 18 to 34 range, 20% of those people who were hospitalized ended up in ICU, 10% needed intubation, and 2.7% died. The most significant comorbidities with that were obesity, diabetes, and hypertension, and the risks of ICU, intubation, or death all increased the more of those comorbidities they had. So the main takeaways from this study, besides the fact that I am no longer in the younger patient age demographic, is that that younger people aren't immune. People, 20% of these young people who were in hospitals for COVID needed intensive care units. So it can get very serious. We tend to brush over younger patients with COVID. All right, so you can find the sources for today's stats and trends, as always, in the COVID tracking project, the New York Times Counter, and mass.gov's own COVID dashboard. For more from the MassSupport Network, you can find us on social media or on our website at masssupport.org. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.